A novel strain of coronavirus, SARS-CoV-2, was first detected in December 2019 in Wuhan, a city in China's Hubei province with a population of 11 million, after an outbreak of pneumonia without an obvious cause. The virus has now spread to over 200 countries and territories across the globe, and was characterized as a pandemic by the World Health Organization, WHO, on March 11, 2020. As of 9 o'clock on May 3, 2020, there were 3,349,786 laboratory-confirmed cases of coronavirus disease 2019, COVID-19, infection globally, with 238,628 reported deaths. What are coronaviruses? SARS-CoV-2 belongs to a family of single-stranded RNA viruses known as coronaviridae, a common type of virus which affects mammals, birds and reptiles. In humans, it commonly causes mild infections, similar to the common cold, and accounts for 10 to 30% of upper respiratory tract infections in adults. More serious infections are rare, although coronaviruses can cause enteric and neurological disease. The incubation period of a coronavirus varies but is generally up to 2 weeks. SARS-CoV-2 is a new strain of coronavirus that has not been previously identified in humans. Previous coronavirus outbreaks include Middle East Respiratory Syndrome, MERS, first reported in Saudi Arabia in September 2012, and Severe Acute Respiratory Syndrome, SARS, identified in southern China in 2003. MERS infected around 2,500 people and led to more than 850 deaths, while SARS infected more than 8,000 people and resulted in nearly 800 deaths. The case fatality rates for these conditions were 35% and 10%, respectively. SARS-CoV-2 is a new strain of coronavirus that has not been previously identified in humans. Although the incubation period of this strain is currently unknown, the United States Centers for Disease Control and Prevention indicate that symptoms may appear in as few as 2 days or as long as 14 days after exposure. Chinese researchers have indicated that SARS-CoV-2 may be infectious during its incubation period. Where has the new coronavirus come from? It is currently unclear where the virus has come from. Originally, the virus was understood to have originated in a food market in Wuhan and subsequently spread from animal to human. Some research has claimed that the cross-species transmission may be between snake and human, however, this claim has been contested. Mammals such as camels and bats have been implicated in previous coronavirus outbreaks, but it is not yet clear the exact animal origin, if any, of SARS-CoV-2. How contagious is COVID-19? Increasing numbers of confirmed diagnoses, including in healthcare professionals, has indicated that person-to-person spread of SARS-CoV-2 is occurring. The preliminary reproduction number is currently estimated to be between 1.4 to 2.5, meaning that each infected individual could infect between 1.4 and 2.5 people. Similarly to other common respiratory tract infections, MERS and SARS are spread by respiratory droplets produced by an infected person when they sneeze or cough. How is COVID-19 diagnosed? As this coronavirus affects the respiratory tract, common presenting symptoms include fever and dry cough, with some patients presenting with respiratory symptoms, for example sore throat, nasal congestion, malaise, headache and myalgia, or even struggling for breath. In severe cases, the coronavirus can cause pneumonia, severe acute respiratory syndrome, kidney failure and death. Diagnosis is suspected in patients requiring admission to hospital with signs and symptoms of pneumonia, acute respiratory distress syndrome or influenza, and in those with a new, continuous cough or fever who are well enough to stay in the community. A diagnostic test has been developed, and countries are quarantining suspected cases. What can I do to protect myself and my staff? An updated Standard Operating Procedure, SOP, for community pharmacies, published on March 22, 2020, sets out measures to protect pharmacy staff, including advising customers to keep a distance of at least 2 meters from other people, limiting entry and exit to the pharmacy, and installing full screens to protect members of staff from airborne particles. How can cross-infection be prevented? The WHO has created a range of infographics to illustrate how patients can protect themselves and others from getting sick. However, most of the advice is similar to what would be provided for colds and flu. There is no specific treatment for COVID-19. Although vaccines can be developed to treat viruses, owing to the novel nature of this infection, no vaccine has currently been developed, and the process to develop one may take 12 to 18 months.